My name is Carrie Parrish, and I am a nurse practitioner in the endocrinology department. Endocrinology is the field of hormone imbalances, whether it's in the thyroid gland, the pancreas, the ovaries, the testes, the pituitary gland, the adrenals. It's just hormone imbalances that we're trying to figure out why and then fix them. The endocrinology department sees a wide gamut of patients, but notoriously I'm seeing thyroid patients and diabetes with a little bit of osteoporosis. Being a type 1 diabetic, that's something that a lot of people don't know, but always led me towards patient care and helping others and just being able to relate to people that have the same issue going on is nice. A new patient appointment is pretty in-depth. They always review diet with somebody, especially with diabetics. I review diet, review exercise. Believe it or not, a lot of people don't consider beverages or liquid intake food and that it has carbohydrates in it. So that's always a big thing. If they're diabetic, they should be checking blood sugars and bring the blood sugars or the meter to the visit so we can review those as well. We review most recent labs so we can come up with a good game plan for them. Diabetes, well, there's different types of diabetes. There's type 1 diabetes, which is beta cell destruction, meaning that the patient needs insulin. That's the only option. So that's type 1. There's some little subsets underneath that, but we won't get into that. It's a little more complicated. Then there's type 2 diabetes, which is insulin resistance. And sometimes this can be prolonged by healthy lifestyle and diet and reducing your weight, not being overweight. There are more options than insulin with that, multiple other medications, and like I said, lifestyle modifications. There's also gestational diabetes is another thing, type of the diabetes that I follow patients for as well, which is diabetes during pregnancy. If they're a type 1 diabetic, a lot of times people will have some rapid weight loss, and that's how they can normally find out. They'll present with weight loss to the doctor. Some of the similar ones are increased thirst, increased urination, increased hunger, fatigue, can't quench your thirst. That's a big one that I hear. With the type 2 diabetes, people can have symptoms for years or even the diabetes for years and just kind of play it off. And then they'll go in finally for a physical, or a friend will check their blood sugar and it'll be 400. If somebody is watching this and is concerned that somebody has diabetes or suffering from diabetes, I would recommend them get into their primary care doctor so a physical can be done with labs to confirm diagnosis and medication or treatment can be started. I put my heart into what I do each and every day by being able to put myself in my patient's shoes. Like I said, I live with diabetes on a daily basis, so I know what they're going through, and it's not always easy. There's struggles, there's highs, there's lows, but just being able to relate and know how they're feeling and what they're going through.